Good morning. Thank you for attending this presentation this morning. And I understand that this is your normal OTPT meeting time. So thank you for letting me present this presentation during that time. But I hope you can still get everything discussed that you need to get discussed. But anyway, I'm Sarah Holman. I am an occupational therapy student at the University of St. Mary. I have been completing my capstone project under Jessica Lamb, the OT here in the Lee Summit School District for the past 10 weeks. This is now week 11 out of 14 of my capstone project. So at the time of presenting this, recording this, I am beginning to wrap up the whole capstone project process. I just wanted to say thank you for allowing me to bring in everything that I've been gathering together, just trying to find OT's role in addressing visual efficiency skills specifically, which are those oculomotor skills, into the school setting, and just kind of making sure we understand what therapy's role can be on this particular area of visual skills. So we'll go ahead and get started into it. So I feel like we have quite a bit to get through here today, or at least I just have all the objectives really broken down into a lot. But we're going to get started with getting into the general anatomy that's related to the visual system. I am going to cover the visual system between all three main components of the framework we're going to be kind of working within, but the focus of the whole project is on just that middle section of the visual system. And then the second part, we're gonna get into that middle section of the visual system, which are gonna be known as the visual efficiency skills. So that's gonna be stuff like accommodation, convergence, saccades, pursuits, stuff like that. And then we're gonna break down what each of those mean. And then we're going to get into what I think is the fun part of this presentation. We're going to look at how to screen for these different visual skills, as well as ways to treat it. And I give some examples of different intervention activities you can use to address convergence, accommodations, saccades, pursuits, etc. And then we're going to get into introducing the visual toolkit and visual program that I've put together. The visual program is more so just bringing instruction to the instruction of how to screen for these visual efficiency skills, and has some of these ideas in the intervention. So there's going to be a lot of relation between the program and the project here. So for the presentation here, the presentation will give you a lot of information that you'll need to know for the binder. And then there's also this fun visual toolkit that I have right in front of me. Fun basket has the toys in it. That's the even more fun part. So yeah. So I just want to make sure I include a little blurb on scope of practice here, and I'm sure you guys are well aware of this. So obviously we know as therapists we need to make sure that we are doing what we can do, especially from a legal perspective. There is a big thing about what's within OT scope, what's within optometry scope. We just want to make sure we're doing what we can do and leaving anything else to the optometrists. That's why I'm trying to refrain from using the word evaluation. You will see that word in the slides here, but I don't want to call it too much evaluation, more so just screening, because a big part of the evaluation process is going to be that collaboration with the eye doctor that a student of yours may have seen in the past, or that they probably should go see an eye doctor. But that's going to be collaboration with the parents, as you guys know. But I just want to make sure we get that cleared up before we really go on to this. And I will be back to this concept as we talk about interventions later on. Alrighty, so I mentioned a three-part framework that we are primarily going to be speaking within. So this is the three-component model of vision. It was developed by optometrist Mitchell Scheiman, I'll go ahead and get that book out. He wrote this book. It's specifically for OTs. I think his wife is an OT, so like he kind of became a big advocate for OTs working alongside optometry when it comes to visual efficiency disorders. The book's called Understanding and Managing Vision Deficits: A Guide for OTs. It gives a lot of great insight and understanding on what we can and cannot do in this space. So when we look at this three-tiered model, the first level at the base is a visual acuity. So that happens pretty much all in the eye level, like of the visual system, like literally in the eyeball, the retina, and the physiology that the retina does and processing images, and just the general eye health. Next up is where we are going to be focusing today, because this is a part of the visual system that we really don't hear a lot about in the therapy space, but it is so important to be able to address it. I know therapists are already really good at addressing that top tier in the triangle here, with visual information processing being visual perception, where you have your figure ground, your visual memory, visual sequential memory, form constancy, visual closure. Therapists are already great at that, especially in the school setting. You guys are probably the best out of all OTs at addressing visual perception. But I just want to make sure we draw in this underlying layer with visual efficiency skills, because we need to have our saccades and pursuits, combination, binocular vision skills, and make sure we don't have any diplopias going on. Make sure all this is intact before we can go into visual perception, because a lot of the reading I've done was showing that generally when you get visual efficiency squared away, visual perception really just follows suit, and there's generally hardly anything you need to do there. Yeah. All right. Here's the nitty gritty kind of fun anatomy and physiology piece of it. Oh, here's just a fun little fact that I saw when I was really trying to get a deeper understanding of the anatomy and physiology. 70% of all sensory receptors are in the eyes, and that's in relation to the entire body. I just thought that was cool. So that just shows some importance that the visual system and just how much we take it for granted in our everyday lives. So to get into it, the visual system functions with two streams. So we all know that the occipital lobe of the brain controls visual input and converts it to make meaning in our brain, and so we can work with that functionally. Well, there's also the dorsal stream, which is going to be, I don't know if you're going to pick up the cursor here on the screen, but the dorsal stream is going to be this purple arrow, and the ventral stream is going to be this red arrow. So the dorsal stream goes to take in visual input that comes in from your peripheral vision. And the part where visual efficiency skills comes in to dorsal stream, ventral stream, is that saccades and pursuits start to venture outside of your central vision. Sorry, I didn't mention that part yet. Let me back up. So the dorsal stream, so that purple arrow, works with magnocellular cells. That's just what the cells are called. And they can take in visual input from your peripheral vision. The ventral stream, that red arrow, contain parvocellular cells. Again, just the name of the cells that take in visual input from your central vision. And of course, the eye level with visual acuity is doing its thing, and then we have this next layer with visual efficiency that's going to be doing their thing. I feel like this is a mess. I'm sorry. Again, I just want to make sure we go ahead. I want to go ahead and say that we have a Padlet that is available at the end of this presentation. So if anything feels jumbled, or either from my speaking or jumbled in your brain, just feel free to ask any questions that you may have about anything in this presentation. That Padlet has a QR code and a link on the very last slide. So anyway, should have said that earlier. But the ventral stream is taking visual input from the central vision, and where visual efficiency skills come into play with that So we have like fixation occurring in your central vision. Fixation is just where you're focusing on one object and your eyes have a stable gaze on one object or one target when you're reading, for example. And now Saccades and pursuits are going to be venturing outside of that central vision. That's why I have the eye kind of toward the side. The skates jump to the outside or the inside. It can be to the medial side or the lateral side of the eyeball. Pursuits are going around the peripheral of the visual field as well. So that's where visual efficiency skills show up in dorsal stream and ventral stream. So dorsal stream is peripheral vision, ventral stream is central vision. So we'll make sure that's clear. I hope this works out. So this is really the detailed process when I was really trying to get a good thorough understanding of the whole visual system process from light coming into the eye to the making meaning of what we are seeing visually. So we're going to start with at the eyeball level with visual acuity. This is where the photoreceptors are, the cone cells and the rod cells that are in the macula or in the retina of the eyeball that take in light and color perception, goes to bipolar cells that are in the other retina, ganglion cells, and just all those anatomical structures I just mentioned is just the process it goes through to form a inaction potential to the brain to begin the visual processing process to eventually get to visual perception. And then after visual acuity, it will start getting into the visual efficiency stage of it. I just want to highlight some of the structures that are here in this little drawn diagram. So the first highlight right here, I don't know if you can see my cursor, but that's cranial nerve 2, and then which we know does have a part in the visual system. And then we get into the thalamus. That's not right. No, that's the optic chiasm. I don't know why I said that. Okay, no. This is the optic chiasm right here. That's just where directionality is sorted out. Oh, there it is. Okay. And then the optic tract is that third highlight here, just to point out what those are. Sorry, my notes kind of got out of order. The thalamus is down here where the red and the blue dots are. And then the visual cortex is down here at the back of the brain. So you can think of this, the ventral side of the brain and the dorsal side of the brain back here. And once you get to the thalamus and the visual cortex, that's where visual information processing takes place. I am going to talk more about visual perception just to make sure we have everything here. And the visual cortex makes the visual image with orientation, movement, contrast, light, depth, etc. That pulls in information that's coming in through the ventral stream and the dorsal stream. Right. So as for visual perception, there are 10 specific areas in the brain that have specific functions to different like visual input shapes that come in through your eyes. This determines the what and where something is in the visual field. Goes back again to central versus peripheral vision. The what that we are perceiving through our visual processing, it takes place in the central vision. So we're fixating on that object and we're like, oh, that's the letter A when we're reading, or the word book. Just random words. And then where is when our saccades and our pursuits start to venture outside of our central vision and just kind of taking a place of like visual spatial awareness, and that starts to get into visual perception. I know I keep going back to underlying layers, but I guess this just really emphasizes the point that all three of these layers are constantly working together, and you can see where acuity goes to efficiency and efficiency goes to perception. So I tried to really put these 10 specific areas on the brain here. I don't think it's exactly right, but that's the general like pathway or the general relation that they are into one another. These arrows, I just highlighted the dorsal stream and the ventral stream yet again, so you can see where that is. V1 is the primary visual cortex, so we're starting in the occipital lobe. And then V2, we go to the secondary visual cortex, just it gets processed even more there. And then we have the other structures that are known as the dorsal ventral extrastriate, specialized. And then the next, and V4 is specialized for color perception and recognition of complex shapes in the intermediate vision. V5/MT is in the middle temporal lobe, which is specialized in motion processing, particularly direction selective neurons. So that goes back to the optic chiasm and has some relation to that. V6/DM is the dorsomedial area, responds to visual stimuli associated with self-motion in wide field of stimulation. The LOC is the lateral occipital complex, which specializes in object recognition, responds strongly to shapes and coherent objects, than scrambled images. FFA is the fusiform face area in the brain, which is highly specialized in face recognition and identifying individual objects. And then the PPA is in the hippocampus, which specializes in responding to scenes, landscapes, and buildings. So we're really starting to get into the dorsal stream here, really with the past couple or few that I mentioned. And the PPC is part of the dorsal stream, processing spatial location, depth perception, and guiding visually directed actions like reaching and eye movements. So this is correlating into eye-hand coordination, correlating the saccades and smooth pursuits to the motion that you're making when you reach for an object. And you can't really see my hand when I reached out. The ventral stream goes to the temporal lobe, and the dorsal stream goes to the parietal lobe for processing visual input that came through the occipital lobe. This is especially important, like when you're reading a text. I will talk a little bit about how reading works visually. I'm going to include a little bit of the pediatric conditions relation to ocular motor skills that I talked about heavily in the presentation I presented to the teachers last week. I'm going to bring that up a little bit during the dyslexia section. I apologize for not getting anything on the slide to discuss the near vision triad component of this, but I'll just go ahead and run through this real quick. So the near vision triad, as the name implies, consists of 3 parts to it. So the near vision triad is a larger picture, a big picture version of what convergence is doing in the eye. So obviously convergence is one part of the near vision triad. But convergence, in order for convergence and near vision to work effectively, we need to be able to have light going into the eye to activate the pupillary light reflex. So light, as we know, light suddenly exposed to the eyeball will cause the pupil to constrict. This goes along with the general understanding that when you have a bright light shown in your face, your pupils will constrict. And then when they're dilated, like we go to the eye doctor and you have your eyes dilated, your pupils will be much bigger than they normally are. And that's why you wear those sunglasses when you leave the doctor's office. So you have pupillary light reflex, convergence working together so your pupils constrict during that convergence. That's something that you can look for during the screening of convergence if you see fit to do that with a student. And that third component is the change in the shape of the convex lens in the eye. All right, so I'm going to go ahead and define all these visual efficiency terms. I think I'll, after I record this presentation and send it off, I think I will go ahead and type in all the definitions into the slide for your convenience, so you don't have to go back and listen to it, find it in the video, you can just find it in the PowerPoint visually. So I just want to make in I just wanted it to be in this format just to see like what terms are under another term, if that makes sense. So the big overall term is visual efficiency. That's just everything was here that has to do with the ocular motor movements of the eyeballs. Combination is one eye's ability to focus on an object. Oh, I can't think of the word I want. In the case of the other eye being blurry or having some sort of lack of focus, it helps the brain to be able to see one image between both eyes that may not be working together very well from an accommodative standpoint. So making sure it's blurry or not. Binocular vision goes along with that, where both eyes are working together. I don't really talk too much about binocular vision in this presentation because I'm pretty much leaving that to the optometry side. That was going to be an area where it's going to be really hard to make sure we break away from what the eye doctors are doing. Again, that whole legal component with our scope of practice. And then ocular motility is really the biggest thing here that we're focusing on. Ocular motility is just simply efficient eye movements. So fixation isn't really an eye movement, but I include it in this section anyway because it's still necessary and we still do it when we're reading anyway. So fixation is the eye's ability to stabilize on an object before moving on to fixating on another object. Vergence. So we have two vergences. There's convergence, which we talked about, where those eyes are working together and come together. There's also divergence. I really don't talk about that in this presentation either, but the eyes really just go out away from each other at the same time. But it is a thing. And then saccades. I've kind of alluded to a lot of these earlier, but saccades is jumping from one object to the next, and you can easily combine some of these movements so you can fixate on one object, do a saccade jump to another object, and then you come back. You will see that when I attempt to demonstrate these screens on myself with the computer camera in front of me. But I fixate on one pencil over here, and then I make a saccade jump to the other pencil, and I fixate again over there. And it happens so quickly, you don't really think of it as fixation, but it is in between the saccades. And then smooth pursuits is where you're smoothly following or tracking an object as it moves through space. So why is this all important? We are in occupational therapy, so obviously we need to make sure we bring everything back to our daily function. So we're in school-based settings, so the biggest focus here is going to be those academic tasks like reading, writing, cutting, pasting something to paper with glue, even catching a ball at recess or whatever activities kids are doing out there, tracing. All these activities require some sort of visual efficiency scale or another, or a combination of all of them or multiple of them. And we can also relate this to our ADL and IADL tasks that they do before, after school, or even during the school day as it pertains to the school day as it's necessary, of course. Like for example, when you're getting dressed in the morning, you are scanning your closet or your drawer for the appropriate garment you need to wear for the season. You're looking for that particular t-shirt, looking for a particular sweater, or if you're doing a spirit day and you want to make sure you wear your wackiest shirt you have. I don't know what spirit days you guys are having, but you have to look for it. You have that visual memory piece in your head, and your eyes are having to make those pursuits or even saccade jumps as you're scanning, tracking your closet, finding that one specific item. There's figure ground in there, all sorts of visual tasks that we are going through without even thinking, because our visual skills are so often taken for granted in our day-to-day activities. Okay, I think I'm done talking about a lot of the anatomy and physiology stuff, so I'll go ahead and mention this here. Another piece is like navigating hallways. So going from when a student is transitioning, not just within the classroom, but even from the classroom to recess to lunch to the library, wherever they're going, they also have this visual input coming in from the periphery, which is the dorsal stream that I was talking about earlier. And sometimes that dorsal stream likes to work against our proprioception or vestibular systems, and we just have to make sure we are addressing that as well. And I know you guys are already really good at addressing proprioception and balance. So in that, I mean, alluding to the intervention section in this presentation a little bit, but a big part of the intervention, as I will talk about later, is combining the oculomotor skill to some sort of proprioceptive or vestibular input in the treatment that you set up, that you instruct the student to do. All right. I have evaluation here. That's really just to be a collective term, but what we're going to do with visual efficiency skills, they're all screens. And I just have it under the evaluation section because it's going to occur during your evaluation of a student. So we first go look at saccades. I have a couple different videos of each thing I do because I wanted to kind of exaggerate the saccade movements because I feel like my eyes weren't moving a whole lot. That's why the second video is going to have the pencils further away from my head. So ideally when you do this presentation, ideally when you do these visual screens, like for saccades, for example, you're going to set up the pencils like they are in front of my face. So you want to make sure that the pencils are set up no wider than the student's face or tall if you're doing vertical. You'll see that video here in a moment. Same thing with pursuits. Your circle is going to be basically, I guess you can call it the circumference of their face if you're seeing it as a two-dimensional image, even though they're not two-dimensional. You'll see it in a moment. But let's go ahead and watch the saccades jumps. You can see where my eyes are jumping to the pencil on the left. They fixate on that for a second, and then they jump back to the pencil on the right. Sorry. Here's just a bigger one where I can exaggerate the movements a little bit. Just make it a little bit bigger of a jump. I don't know why my hands were shaking during that, but just something to look out for when you're doing saccade jumps. You want to make sure that their head is still. Even if it means holding their head still for them, probably easier if you have someone else holding their head still, like Dakota or another therapist, or their teacher, or I don't know, not teacher, but I think it might be paraprofessional. Sometimes I see other staff members come in with students. Not exactly sure what their titles are, but you get the gist. Alrighty. So saccade movements can also be done vertically. So you have those extra. I didn't talk about the extraocular muscles, but there's 8 of them, 6 of them. I got the number mixed up. But horizontal movements, you're gonna have the lateral, medial, extraocular muscles moving the eyes back and forth. Now for vertical saccades, it's gonna be the superior and inferior extraocular muscles that are moving the eyes up and down. I'll go ahead and play that. So you see I have the pencils framing my face at the top and the bottom. Again, still make sure you have the student's head still. And then I just have this one to exaggerate the eye movements for you guys to see. Alright, so for pursuits, this one was really hard to try to demonstrate on myself with using the front-facing camera on the computer here. We should go ahead and get that out. We'll not ignore this. Alrighty. So you actually have a couple of different fixation sticks that are coming to you in this fun visual toolkit with all the toys in it. I should be getting the other visual toolkit or the other fixation stick in the mail today. It's just been on a slow boat from China apparently. But this one, you actually can see it better in the video in the PowerPoint, but it has a toucan on it, and yeah, you don't really need the other numbers on this side, but there's a ruler on the back side of this fixation stick. This is just the one I was using for the demonstration today, just because it's the one I have. I don't have the other one yet. The other fixation stick has, I think it's a horse at the very top of the fixation stick. There's a duck on it, and there's other animals as well. You would instruct the student to look at that image that's on the fixation stick. And yeah, as they follow it. Sorry, I'm starting to get confused with another screen. Let's go ahead and watch this. And it's gonna be kind of hard to see my eyes, but just trust it. That's why I try to do a larger circle on the next video. It doesn't really look like my eyes are moving much, but it's very subtle. Okay, there's a little bit you saw there. And also, I'm looking at the toucan on the screen, not the toucan on the stick. So it's not the best simulation or demonstration, but I'm trying to give you an idea. Here's a. I don't like this video. I put the wrong video. On there. There it is. I think that's it. There we go. I have a duplicate. And during pursuit testing, you do not have to make sure that the student's head is still. Let them move their head because you are going to be noting any head movements that they make. You can note that in your documentation. Another thing also with saccades, I should have mentioned this earlier, make sure you make note of any overshoots or undershoots that they make. So if they're looking at the pencil here and they look at the fixation stick, know if they kind of go outside of that or not quite as far as it should. Like or if it kind of makes a stutter. So if it's an undershoot, they may stutter and they do get to the desired target they want them seeing. Make note of any overshoots, undershoots, because they may, I don't want to say accommodate because we use accommodation for another thing, but they may, or not compensate, but they may accommodate for their mistake that they did. So make sure you make note of that as well. Same thing with pursuits. I gotta move on to the next screen. I don't like my face in that. I look bored. What am I saying? Sorry. And same thing with pursuits. Make sure that you make note of any deviations or if they're not smoothly following the motion that you're doing with the fixation stick. I know pursuit testing does look a lot like the cardinal gaze testing that you were probably shown in OT school or wherever you saw it yourself, where you have that follow the H shape or the X shape. I just want to. You could use that for pursuits, but since there is kind of the stop in it, you have to go back and make a new line. I would leave that specifically for cardinal gaze, which is another visual screen that can be done, but that's just looking for the full full active range of motion of the extraocular muscles. So at the end of this is kind of an extra thing. I don't have the presentation, but when you're doing cardinal gaze testing, you're having them follow with that H shape. You might see a little bit of that nystagmus. That's just the nystagmus is just that last little bit of the extraocular muscle stretching its most extensibility that it has in that direction. But I just want to make sure that is separate from pursuit testing. But you can still do cardinal gaze testing if you are interested in if there's a limited range of motion that an extraocular muscle may have. You can do that during like an amblyopia or strabismus case if a student has a diagnosis of one of those and their eyes not converging or not going in medially as much as it normally would in a normal case or in a normal scenario to do that there. So the next screen is for accommodation. And with this one, I would suggest with accommodation having both fixation sticks readily available. You're going to use the other fixation stick that I have yet to have delivered to me for the actual accommodation testing, and then you're going to use this one for the ruler that's on the back. I'm going to go ahead and play that video now. So you're going to start by instructing your student to look at the image that's on the fixation stick. On the other one, I think it's going to be a horse that's at the top of it. There's other pictures on it. I'm going to instruct them to let you know. You can't really see that anymore. You're going to instruct them to let them know when that image starts to become blurry. And the distance at which an image can become blurry does increase. The distance increases with age, but it increases very gradually until the age of 40 or so. And age 40 is when near point of accommodation is basically gone, and when a lot of adults tend to get glasses at that time. That's the reasoning for that. But since we're not focusing on that, what you're going to be seeing is 3 inches for near point of accommodation. That's by age 18 or 13. 18 is the same as 13. By the age of 13, near point of accommodation is 3 inches. So the image that you're fixating on, as it gets closer, it starts to get blurry at 3 inches away from the student's nose. It is a little bit higher in elementary age students, but it does as the visual system matures, as the student ages, it decreases to that 3 inches. And then by the time someone is about 18 or 20 years old is when accommodation does start to, the distance starts to increase again, and you have to start holding it back to be able to focus on the image. So generally you're going to be seeing generally it's going to be about 3 to 5 inches. It might be a little bit greater if there is an accommodative insufficiency, but it's not going to be terribly great of a number. I hope that makes sense. Again, I have a Padlet at the end of this presentation if you have any questions for individual things. And I'll try not to go down any detailed rabbit holes in those responses. Alrighty, so I wanted to show you the Brock string that I made for you guys. That's also in this toolkit. So I wanted to point out all the colors of beads that I have on here. So the first one here is purple, second one is orange, and the third one is green. So when you go to set this up, you can easily right there. When you go to set it up, that purple bead or the first bead should be about 3 or 4 inches away from the pencil or the student's nose. And then the third bead should be about 20 inches. I don't know if that's about 20 inches, but close enough. And then the orange bead is pretty much right there in the middle. I don't have an exact measurement for that. So what you're gonna do, so this, the Brock string plays off of a principle called physiologic diplopia, and it's just a normal thing that happens when you go to cross your eyes, you see double. It just happens. So what you're gonna do, you're gonna instruct your kiddo to look at the purple bead, the first bead, they're gonna fixate on that bead. And what they should see is an X. I'll put drawings in the PowerPoint slide to show what each one looks like. You should see an X shape going through that bead. Okay, when they see that, assuming they see that, you're going to move on to that second bead, the orange bead. You're going to have them look at that orange bead, and they should see an X shape crossing through the orange bead. Once they do that, you're going to move on to that last bead with the green bead. Instruct them to look at the green bead, and they should see 2 strings going to that green bead. That's the Brock string. I was just trying to demonstrate that here on camera. It's hard to really see what I'm seeing because my vision is my vision, and you can't see that on the screen because you're not crossing your eyes and you don't have it positioned the way I have it positioned. But I would like you guys to give that a try on yourselves just so you can see it. Whenever you do get a hold of this visual toolkit and playing with Brock string yourself. Righty, and then here's just images of those diagrams, drawings I drew out for you guys just to see what I was seeing or what you would see during Convergence screening. All right, I did want to throw this in here. So there is a true standardized test that you can do, and this is the best one that you can do as an OT yourself. So it's called the Developmental Eye Movement Test. It has normative values for oculomotor accuracy and skills up to the age of 13. However, you can use it with middle and high school students if you feel the need to do so, of course, because visual skills do not change much or at all into adulthood. Really, that only one I was talking about was accommodative skills, and that the distance of near point of accommodation will change with age until the age of 40. But other than that, visual skills pretty much mature by the age of 13. It is a one-time fee of $89. Don't remember how long it takes, but it doesn't take too long, if I remember correctly. I'd have to get back to you on that to make sure I give you a good answer on that, but this is just something for your consideration to look into, just to help with normative values in your evaluation and intervention processes with students if you choose to do this. This is a nice graphic that I stole from one of Robert Constantine's presentations. He is an OT out of the Florida area. I think he's in the Florida Panhandle area. But he ended up presenting all of the PESI courses that I don't want to say participated in, but that I took at the beginning of this capstone project process. And he was the one that really kind of helped me find OT's role in this and make sure and help me to kind of consolidate all this information. So he has this nice graphic. So Robert Constantine, he does work a lot with kids, but he also works a lot with adults and just works with people of all ages who come in with some sort of visual deficit that's related to visual efficiency skills. And he talks about how common complaints are going to be that they see blurry, they see double, or they see on one side. Generally, the biggest one is going to be blurry. Generally, in a school setting, you're really not going to see any kid saying that they're seeing blurry, double on one side. If any, probably the blurry. But a lot of kids who come in with a visual deficit, it may not be related to any particular condition or diagnosis that they may have, but another, like, well, I guess it could be. That's no, forget what I just said. But it may not be related to well-known pediatric conditions like ADHD, autism, dyslexia, or symptoms related to post-concussion symptoms. They may have amblyopia or a strabismus disorder. If it's a strabismus disorder, they may be seeing double, but the thing is, they're not necessarily going to be knowing if they are seeing double, because that's just how they see it. It's how they've always been seeing. They don't know any different. That's what they know. That's what they've been seeing their whole life. Same thing with blurry. Kids aren't going to know that what they're seeing is blurry. We hear anecdotes of kids getting glasses for the first time and they didn't know that trees were not just green blobs when they walked outside, but there's individual leaves. We hear that from as anecdotal evidence. Let's see, on one side, that's generally related to strokes. That's going to be more so for the adult population. But this is mainly for the blurry or double part. And everything that goes through this chart that Robert Constantine has always ends up with seeing an eye doctor or following up with what the eye doctor has said. So that goes into communicating with the student's parents, make sure they've gone to see an eye doctor and what they said, make sure you have the referral notes from them if that's how this worked out. Yeah. So I just found this to be a really great graphic. And I want to throw this in here for your viewing as well. All right. Here's the other fun part. Fun because we get to play with toys. All right. So the whole objective of coming up with interventions is that and this is a graphic that Constantine himself also described. But a good intervention, a good vision intervention, should have three components. The ocular motor component that you're working on, whether it is convergence, accommodation, well, maybe not accommodation, but generally it's going to be convergence, saccades, and smooth pursuits. You're going to be working on one of the three, all three, combination of some of them and not all, whatever is necessary for that student. And then, so this gets into a multisensory approach, so you can start implementing other sensory systems with the visual system. So the big ones that we're going to work with are the proprioceptive and the vestibular systems. So add a balance challenge, a movement challenge to that activity. Like for example, a really cool activity I saw that Robert Constantine has done with kids that includes all of those. It's particularly related to visual memory, but the visual memory as we talked about earlier, visual memory is visual perception, and visual perception requires the more fundamental visual efficiency skills that are just under that within the visual system. And so this activity is an obstacle course that you set up so you can get stepping stones, balance beams, put tape on the floor, and you can easily grade up, grade down this activity with different like pieces that you use. So the balance challenge with the vestibular system of simply standing on these objects, and the obstacle course in the proprioception of stepping from one item to the next. Maybe even include the upper extremity in there if you can. And then, but right before they go through this obstacle course, you have memory cards set up, or cards that have a match to it. And I know you guys do a lot of stuff digitally, and you have the memory card game that you have available on the smart, I guess that is a smart board. That's a new smart board. That's it set up in your therapy room. I know you have that, but I would suggest getting a memory card game. I could not find one when I was trying to put this visual toolkit together. I might try to find one before I get the visual toolkit to you. I would like to get this to you before I go to Chicago on Wednesday. I'm going to talk to Jessica about that so you can play with the toys. But where am I going? So the whole point of that is, I was talking about that visual memory activity. So before you instruct the student to go about this obstacle course that you have set up, you have a few cards from that memory card game, matching card game, set up at the beginning of the obstacle course. You have them draw one of the cards, and you have them study it. Like, okay, make sure they really look at that image, because they're gonna have to remember that card. You leave that card there after they feel like they have saved the card and they know what is on the image. And then you have them go about the obstacle course. They get through the obstacle course, and vestibular and proprioceptive systems are going to be incorporating that dorsal stream, as well as the in between the central vision tasks of looking at the card. Should throw that in there as well. So they go about the obstacle course. They're using the dorsal stream, the vestibular system, proprioception, everything. So they get to the end of the course. Those same cards that you saw at the beginning of the obstacle course are also going to be set up at the other end of the obstacle course, and they're instructed to bring back the card that matches the card they saw at the beginning. And they bring it with them as they go about the obstacle course again. And they bring it back to you, they show it to you, and if they got it, you can say, good job, you got it, blah, 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 and they have fun, and you can do however many trials you want to do. And or if they do it wrong, just you understand upgrading, downgrading, and we'll just go from there. I just thought that was a really fun activity that Constantine described in one of his courses. And that's a really good example of the 3-tiered model. Oh, there's another thing I wanted to say there. But you mentioned the auditory component, or you saw the auditory component on that previous slide about a good intervention. You can also incorporate other sensory systems like the auditory system. Let me get my metronome out. I did not have this set up ahead of time, did I? Let me get my metronome as just an example of this presentation. You can use my thing here. You can use my example of this here, but this activity is called tap slap, also an activity stolen from Robert Constantine. But I'm gonna turn on this metronome that I have on the phone because I played slow stuff, and of course I have a metronome on the phone. But this activity called tap slap, you're going to slap your left hand on the table every time you see a dot to the left of the line. So we're going to start at the upper left-hand corner, and we're just going to go across like we're reading. So when you see a dot on the left of the line, you tap your left hand on the table. When you see the dot on the right side of the line, you're going to tap it your right hand on the table. When you see the dot on the line, you're going to tap both hands on the table. So just for an example, yeah, I'll just make exaggerated movements so you can see my hands. 3, 4, 5, 6, 7. Left, left, right together, right, right, left together, right together. That's the gist. I just did the first line there. But the idea is to couple what you're seeing on the page with the proprioceptive movements. You're crossing midline, which you also saw that on the previous slide, and also combining that auditory input. Because I know you guys are OTs and you are great at implementing all of the sensory systems, and the visual system is just one of those visual systems. So we're using all the others with it, and this is a way to make sure we're really setting ourselves apart from the field of optometry and ophthalmology. All right, I'm back. I just had to change study rooms here at the library because my time was up. Anyway, so I kind of added this section of the presentation in, not terribly at the last minute, but later. I just thought maybe incorporate a little snippet of what I presented to the teachers in the presentation I recorded last week on Friday. So, the presentation I focused on, the topic I focused on with them is the relation of ocular motor skills to well-known pediatric diagnoses, specifically ADHD, autism, dyslexia, and post-concussion symptoms. I just wanted to get into a little synopsis of what I talked about with them. But same thing with that presentation here. I have to mention a disclaimer with the relation to those well-known diagnoses. So just because a student has a diagnosis of autism, ADHD, etc., it does not necessarily mean that addressing the visual system alone will fix all their behaviors. Vision is just one part in how we operate as a person. This indicates a need to consider in depth just as much as any other sensory system. For example, ADHD may not cause a visual deficit per se. ADHD alters the neural connections pathways from the norm, and it is one of these that affects the performance of saccades, for example. And that's a little bit of an allusion to the ADHD section. So for the ADHD component of this section of the presentation, I was talking about how 15% of kids with an ADHD diagnosis have an ocular motor problem, and this came from a 2023 systematic review that was referenced by Robert Constantine in one of his courses when he was talking about a seemingly relation between visual efficiency and these conditions. And he was talking about how that research finds that and also further research that I try to find to help make the case for this part of the project. The research that I had found, from what I had read, I should say, was saying that these students tend to have more intrusive saccades, as they described it. Intrusive saccades meaning that they're instructed to look at one target, but for some reason they seemingly divert their eyes to another target, whether or not it seems to be a distractor or not. So, for example, they may be expected to look at a certain word during a reading text, or they have to read the instructions before completing an assignment, but it's taking them extra time to do so because their saccades are jumping to undesired targets. And those intrusive saccades occur regardless of distractors being present or not. The cause for this is really not a visual problem, but more of an inhibition deficit, which is another higher cortical neural pathway in the brain. And we know how ADHD is, and I guess for lack of better terms, we often hear like the brain works differently. We hear about neurodivergence. This would be one of those things that would go into that idea. With the inhibition deficit is just it's just not working out quite the same as it normally would. This is that illusion from the disclaimer I mentioned on the previous slide. The research about intrusive saccades occurred with and without distractors. I just said that. So, alrighty. I think that's all I need to mention for this presentation. And then for the autism section of this, there was found to be some of an inhibition deficit, kind of like the ADHD population, but it just seems to be to a lesser extent compared to ADHD. They did find more of a pursuits deficit, which seems to be more common, and I will discuss that further later as I talk about this lack of communication between the central vision slash ventral stream, and peripheral vision slash dorsal stream that we've talked about so much earlier in this presentation. And also, students with autism may tend to overshoot or undershoot targeted or desired objects during different activities that they may be engaging in. This may result in skipping words when reading due to overshoots or rereading text, overshoots or undershoots, just depending on where they are on the page. However, they do tend to do well with making adjustments to finding the appropriate target. So I was talking about if you're interested in screening for saccades in an evaluation earlier, the student may have overshoots or undershoots, but they might have a stutter to get to that desired target. Eventually they're just not making it right away. Apparently kids with autism are generally pretty good at that. And also this is research, and the research for really any of these diagnoses is not that strong, mainly because there's not a lot of it out there. I just want to make sure that's very clear. This is not the main part of the presentation. I was really just trying to find a good correlation between the education toward teachers and why it is important from visually, from a visual standpoint, and how this can aid collaboration between them as teachers and you guys as therapists when you're discussing your caseload. And vision happens to come up in the conversation because you guys know all the information that you get from the teachers and how helpful they can be. They might have a concern about vision, so I just wanted to make sure that was brought to them. There's a little bit more there on the autism section here. The idea of limited or lack of communication between the central vision and peripheral vision is likely due to the not attending to all details in the visual scene. And this has been correlated with um, like toe walking or like the general autistic behaviors that we often hear about with ASD. And they tend to use the peripheral vision more for near tasks. So they're kind of like whenever they're reading the page, they're kind of like turning their head, like because they don't have the interaction as well between the central vision and the peripheral vision. We talked about how saccades and pursuits are constantly crossing that central vision and peripheral vision boundaries in the eye. So you can kind of think of the using their peripheral vision to look at near objects or near activities as their version, I guess, of squinting. So we know like squinting to copy the board, like to try to see that to focus, or a combination in that sense. But this is like they're squinting so they can be able to see images clearly. Specifically, they may not be seeing the whole picture, which relates to the other autistic behaviors that may be the cause for that. Um, I think I got all the information out. Again, if you have any questions about any of this here, please leave it in the Padlet at the end of this presentation, or you can pull it up now and have it going as you go along. That's probably what I would do. But um, again, I feel kind of jumbled in my explanation, so please make sure you feel straightened out in whatever questions that you are asking at the very end. Got that. Yes. So when I was talking about dyslexia in the presentation for the teachers, this was just a very small snippet of dyslexia. I was talking about specifically developmental dyslexia and how vision may be one component of the result of what dyslexia is doing to someone's occupational or academic performance. But I made it clear because I'm like, the teachers probably know a lot more about dyslexia than I do. I'm just bringing one piece of it that I found that may have an effect um, on their occupational performance. But I did bring the information to that I found. And the reason why I wanted to do that because I was learning about how reading works visually, and I found that really fascinating. I was kind of curious if the teachers might already know that themselves, and I look forward to their feedback about how much of that they already knew specifically. But anyway, what I was talking about with them is that just with dyslexia, kind of like with autism, but different. Not instead of between the central vision and peripheral vision and that lack of communication, the lack of communication occurs between two language processing areas in the brain, being the Broca's area and the Wernicke's area. Both are working just fine. It's just that interaction between them, like anatomically speaking, that area in between that isn't quite working the way as it normally would. Um, Okay, let me start over here. So Broca's area controls fixation in the central vision, and the Wernicke's area controls saccades shifting into the peripheral vision. Um, it happens further back in the higher cortical regions of the brain with dyslexia, as opposed to the autism subgroup as we were talking about in the previous slide. And the reading task itself occurs in a series of fixations and saccades. So you fixate on one word, make a saccade jump to the next word, fixate on that one, and then make a saccade jump, constantly going back and forth between fixation, saccade, and so forth. And um, in the meantime, there's that space in between those two areas. Um, there's limited communication, and because of that, it's not making meaning of the letters and the words on the page, causing the dyslexic brain to constantly make these regressions back to the previous word, because it's not because they really can't comprehend the word, they're not giving themselves enough time to fixate on the word to make that meaning that happens between the fixations and the saccades in those language processing areas, or language processing of written communication, I should say, because that requires visual input. I hope that makes sense. Again, if you have any further questions or any clarifying questions, please ask them in the Padlet. I can't stress that enough. And then the last, I guess, like condition, it's more of an overarching thing, but symptoms that you often see after a concussion. Hopefully you don't have a kid that has sustained a TBI or a concussion, but it's not completely out of the cards. Did I have another card? No, that's it. Um, so these are a bunch of different visuals um symptoms that could arise if a kid has sustained some sort of neurological accident to the brain. Visual field deficit, potentially that's more so related to a stroke, but it could be the case in a concussion. Convergence insufficiency, accommodative insufficiency, double vision, sensitivity to light, or another ocular motor deficit. But the most common that you potentially see are accommodation, pursuit, and divergence disorders, because there's this constant competition between visual input from the periphery and those other sensory systems, as we have talked about before when we were talking about the ventral stream and dorsal stream, or particularly the dorsal stream dorsal stream taking in visual input from the periphery and competing with vestibular and proprioception. I know I gave this example to Jessica a while back when I started to get into the details of that in discussion with her, but an example I've heard about dorsal stream is that being in an interior cabin on a cruise ship, for example, there's not any windows to see. So if to your vestibular system, it feels like you are in a stable room, and that's what it looks like. The room looks like it's stable, it's not moving, you're fine. That's to your visual system, I'm sorry. To your visual system, your dorsal stream is saying, we're in a stable room, it's fine, what's going on? Why do we feel sick? That's because your vestibular system is sensing some movement in proprioception, is sensing some movement in your environment, and that's why you might feel sick, and because you have that constant battle between the visual system, dorsal stream, and your vestibular and proprioceptive systems. Again, please ask questions if any of that feels jumbled. Alrighty. I keep saying we're getting into the fun stuff, but I guess this is the actual fun stuff. So this gets into the visual program I put together. I kind of mentioned earlier with the objectives slide that think of this visual program more so as like a guide or a reference book to review these visual efficiency screens that I did demonstrate in video, or at least I tried to do the best I can. Please ask questions if needed. I understand my videos are not the best, but it has written instructions on that for your reference anytime you need to review. It also has examples of what you can use for the ocular motor component, the proprioceptive component, and the vestibular component when you are creating a good addition to addressing these visual efficiency skills. I still need to get a couple of pages 3-hole punch to put into the binder here, but I have a binder put together. It's not, I wrote on it and pinned a label it, but you can't really see it, but I might try to put like an actual label on it. But inside the binder, you will see it starts with the title. Page left is right, right is left. That's just an 8-week visual program. I say 8 weeks because the general evidence that I found, and also the anecdotal evidence that Robert Constantine talks about, he can generally get a kid in and out and working functionally, occupationally, within 8 weeks or so. So both by research and his anecdotal evidence with all of his years of experience working with these conditions and these visual skills. So ideally, one of the, I think it's the citation I have in my lecture notes here that talks about the ideal like frequency and duration of working with some visual efficiency skills in therapy sessions was talking about, what was it? It was, see if I have it right here. 8 weeks, ideally for 2 times a week for 30 minutes per session. Well, it actually says 45 minutes per session in that article, but I went ahead and said 30 minutes per session because I understand that's the amount of time that you allot to working with students, whether it's you or the state. I'm not exactly sure how your minutes are allotted, but I know you do work 30 minutes per session. I didn't want to try to compete with what you're already doing. I was trying to make it fit that, but also fit the general evidence for working with visual efficiency skills. So my recommendation, based on everything I've been learning, is 8 weeks, 2 times a week for 30 minutes a session. All right, this page just has a screenshot of all the pages that is in this binder. So the first page starts with a general outline going through evaluation, do your interventions, do your reassessment, see if you need to continue services. And and then if you do so, intervention, and then ideally discontinue about 8 weeks following that. If you do go further, you guys know what to do to make sure you are applying necessary OT services. I have a little objective statement there on that first page as well. And then for evaluation, you'll see in this chart right here, this is general observation and interview characteristics that you may see or a student may tell you about during the evaluation process. And then the next one, there's like 3 pages here. Evaluation and screening techniques. These 3 pages right here, I hope you can see my cursor circling it. That is detailed written instructions on screening, convergence, saccades, smooth pursuits, accommodation, and even diplopia. I didn't mention that in the visual efficiency screening section with those videos, but I will talk about more further in depth when I get into what's in this fun toolkit with all the toys. And then I do mention all of everything that the general information about the developmental eye movement test if you decide to look into that yourself. And then the last page, which is going to be this chart right here. I understand you can't read it right now, but that's okay. That is a chart that gives you ideas of putting together an oculomotor component, vestibular component, and a proprioceptive component for each visual component. So for convergence, saccades, smooth pursuits, accommodation, and for the dorsal stream as well, I include, which that's going to be a lot of vestibular proprioception anyway, just the nature of it, because that works with spatial awareness. Alrighty, that is it for what is in the binder. And now, here's the toolkit. Who doesn't like to play with toys? Toys are fun, especially if you're my dog. Alrighty, so I already showed you that fixation stick with the chew can on it. So we have this one with the ruler. Hopefully the other fixation stick is in my mailbox or on my porch step at home right now, and I'll get it when I get home from the library here. But that first image looks like a horse on there. I knew the duck was on there. I was relying on visual memory, but I haven't studied it yet. So yeah, I just basically know about that already. And here is the diplopia section, or for screening diplopia. This would involve downloading an app called Worth 4 Dot. That I just have a screenshot of what the icon looks like right here, and then this is what the screen looks like when you go to open up the app on your phone. I did think about getting, there's like a flashlight you can get that has those 4 dots on it as well, so you don't have to pull up the phone for it. But I didn't do that for some reason. I don't know why. But for the Worth 4 Dot, then have your student put on these red-green glasses. Sometimes I play with it and like I'll close one eye so I can only see the green. I close the other eye and I only see red on it. But Worth 4 Dot tests for diplopia or suppression of one eye. And there are only, I do have written instructions on this in the binder, but all the answers mean. There are only 3 answers that can be given from a student. If they say they see 3 dots, that means there's potentially a suppression of one eye present. If they see 4 dots, that's normal. That's fusion, both eyes are working together. And 5 dots is diplopia. There's a double vision occurring there somewhere. Diplopia may be present if there's a strabismus disorder with a turned-in eye with one eye or another, or potentially if they're saying diplopia after some sort of neurological accident with TBI. Hopefully you don't have that case, but it's not completely out of the cards. But that's generally where you would see diplopia, especially in this setting here. After I got these glasses, I'm like, these are actually a good fit for me. Might want to. I haven't looked into it yet. I will try to find that after this presentation, and I'll include it in the Padlet later. I'm gonna try to look up like child size red green glasses because these might be too big for some of your kiddos because you might have a 5 or 6-year-old in there and their head's probably not that big. Well, maybe. I don't know. Sorry, please refresh me on that. I might be wrong. But anyway, so that's for diplopia or suppression testing. Alright, I made a couple Brock strings for you guys. Well, one of them is a Brock string, one of them is made like it, but it's not Brock. Alrighty, so here's the Brock string that I made, and I demonstrated it in the convergence screening video earlier. So you have 3 beads on it. I already demonstrated it earlier. I'm going to do it right now, but you can easily slide these beads. Sorry, left is right, right is left. You can easily slide these beads on that string. So when you go to set it up, kind of eyeball it too. But like at first, go ahead and measure it. So that first bead, that purple bead, should be about 3 to 4 inches from the pencil. The green bead should be about 20 inches from the pencil, and that orange bead is just there in the middle. Just kind of eyeball it. So you got the purple, orange, and the green bead. Since I demonstrated that earlier, I'm not too worried about trying to show that right now. So that is for convergence screening. Convergence screening, and you can also use it for treatment as well. Let's find this other one here. Oh, I lost my pencil. No, I didn't have a pencil. Yes, I did. I'll try to find it later, see if I did. Okay. So for this other Brock string, it's not really a Brock string, but there's 2 beads on this one. You have a blue bead and a pink bead. We're going to use this for saccades or pursuits. And this one would more so be used for treatment purposes. A good way to this would be an activity where it would be really easy to strictly keep it an ocular motor task, but we're trying to avoid that. So you can throw in some vestibular or proprioception challenges by having them stand on a stepping stone, for example, or whatever you have to challenge those other systems, or even put it to music, I suppose. You could do that. But with saccades, you're just going to, let me try to get both beads in the camera. There it is, I think. Yeah, there you go. So you're gonna have them look at the blue bead and look at the pink bead. Blue bead, pink bead, blue, pink. Constantly looking back and forth for saccades. Now for pursuits, I really thought I had this string attached to a pencil as well, but maybe not. So you're gonna have them place. So you want to move one bead pretty close to the nose. You're not really looking at the first bead, you're going to look at the second bead. So in this case, I have the pink one further away. You're going to have them track or follow that pink bead or whatever the furthest bead is with their eyes going around. And same thing, challenge the vestibular and proprioceptive systems, maybe even the auditory systems. I was just thinking about, do it to music. That gives you an auditory component as well. Find a song, or maybe even to a metronome. They should have the um, string go in a circle by 8 counts on the metronome, for example, or whatever phrase is on a song that you have playing. That's just an example that I just came up with. There's something else I wanted to say. I'm gonna see if I put the string on a pencil for you, so you don't have to worry about them having their hand really at their nose. And also, the actual movement of the arm gives you proprioceptive input. It's in itself. Oh, I wanted to go back to the red green glasses thing for a moment. So the red green glasses came with this deck of cards that I didn't realize were gonna come with it until it came. But it's regular playing cards. I'm just gonna go ahead and leave it in the basket for you. So if you put the glasses on and you look at the cards, if you close your right eye, you won't be able to see the print that's on the dark cards here. And if you close your left eye, you won't be able to see the print that's on these cards. That just gives a near task activity to do during binocular vision, like treatment, training, as well. Yeah. Again, this is another thing I want to make sure you're careful with making sure that it's purely OT and it's not just straight vision exercises. But with using hands, you are using proprioceptive input. If you're like placing the card or like reaching from like if you, for example, if you have the light cards on the right side of the body, reaching it over, place it on the left side of your body. It's crossing your visual midline as well as your physical midline as well. So I just wanted to bring that up. That was from the diplopia thing. All right, and then I am leaving a folder in the basket for you. So I before I remembered I was given a heart chart at my fieldwork last summer, I started to try to make up my own heart chart. This is not the heart chart that you have in your toolkit, but when I was at John Knox last summer at fieldwork, my fieldwork educator printed out an official heart chart for me, and it has the instructions. I made a copy for you guys. It is in here. It is kind of crooked, but we fine. So here is that heart chart, and then you also have your near heart chart as well, because for a combination can be different at near than it is at far. You may have more blurry vision in your near vision than your far vision. And I don't think I've talked about accommodation as much, so if you have any questions about that, feel free to ask them in the Padlet. That's all that's in there right now. I would recommend making copies of the heart chart if you feel like you need to. That's not necessarily something that you would send home with kids. That's something you would just keep in the therapy room, therapy gym. You can also make saccade strips out of it. They can have it, the saccade jumps further apart instead of just jumping from, this isn't your heart chart, but jumping from like the H to the E to the 4 to the K. You can spread them apart, cut vertical strips on the heart chart, and have them do bigger jumps. Kind of an upgraded task. Ooh, Marsden ball. This is fun. So Marsden ball can be used. There's some saccades in it. It's more so pursuits. I mean, the convergence may be occurring in there as well. I hope convergence is occurring, but it's not targeting against it. It's more so pursuits and a little bit saccades. I was trying to look up how to make a Marsden ball. I would have done that because that's what my vision therapist did when I was in 3rd grade when I did vision therapy. But it was going to require a tool I don't have. I'm like, okay, I'm not going to try a baseball. I'm not going to try a baseball kit just for that one tool. So I just bought one off Amazon. That's already put. Really, all you need to do is hang it from the ceiling, tie it to the ceiling tile, like the frame of the ceiling tiles, tie it there, and it just hangs from your ceiling. And you can kind of play catch or toss back and forth between you and your student that you're working with, and they can hit the ball, and that automatically adds in a proprioceptive component, potentially crossing midline if they're using the right hand to cross to the left, or vice versa, or if they're going on one, or if it can be ipsilateral as well. You can always add a vestibular component to it, have them stand on a stepping stone, sit on a ball, whatever you have, whatever you can do to challenge the vestibular and proprioceptive systems. But no, this is fun. I used to have a Marsden ball hanging on the ceiling in the basement at home from my vision therapy homework in 3rd grade, and I just thought the vision therapy homework was fun. But the Marsden ball came with these little plastic clasps in it. I'm not sure if that's just part of the packaging or if it can be used to hang it, but I don't think you need it. Just tie it to the frame of the ceiling tiles. So there's that. But no, that's a lot of fun. I was 9 years old and I was just playing. Alrighty, so for convergence, I was trying to find small objects. Went to Michael's. Best thing I found was just these cute animal figurines. Some like small objects, and the kids can have fun with animals. Kids like animals. I like animals. It's all cool. Alrighty, so depending on how many you decide to do, with the kid, I'd say about 8 to 12 is probably a good amount. Like have them kind of like pick out the animals they may want. I'm sure they might take too long to try to do it, so do what you need to do to try to keep them on task. So, like, there's a gorilla, I'm just gonna call it Nemo, the clownfish, there's a dog. Have them pick out probably their favorite animals, they're gonna say, and go with that, set the other sides, just put them back in the bag. And you're gonna split them on both sides here, kind of like you see in the image that I took here. I would suggest putting a piece of tape down or some sort of line that's flush to the table. And you're gonna have them squat down to the table. This is the way I figured it out. And you can't see me, of course. So you're gonna have them look at the table. Now I'm a hippo. So they're like, oh, chimpanzee. Hey, they're also using their if you want to make this more of a dorsal stream activity as well as convergence, don't have them look to the sides where their piles of animals are. Just have them grab one and have them alternate hands while they're constantly looking at that line that they are forming with the animals. And then they can do the same thing coming out, but I don't think that's as hard as lining them up. So for me, coming up with this method of doing it, having them squat down, that does get them into a different position that they don't normally get in. So it plays with proprioception a little bit. The original treatment activity that I got from this was something that Robert Constantine does. Like one example is threading toothpicks into a straw into a cup because they're grabbing the toothpick from the side and they're like really having to converge their eyes and focus on that straw as they put the toothpick in the straw. Another one that he does is he had tongue depressors. They have them put the tongue depressor on their tongue, and they put these small objects on the tongue depressor, and that's going straight out in front of their nose. And they just are there. Didn't know where to find tongue depressors. I don't know how you guys feel about having the tongue depressors. But it's still an idea that you could do. But this is just an idea a way that I came up with it to accommodate for those ideas. Spotted. This was a fun game that I discovered that Rob Constantine also uses. I did see that you already have a spotted game in the therapy room at Trail Ridge already that I did not already realize, but I happened to see it one time. I'm like, Oh, and it says Spotted Junior. That's cute. This isn't necessarily Spotted Junior. It's just Spotted. It comes in a nice little container. There's instructions for a few different games. You can play with it, but you guys already know about the game Spotted. But you can also do a near far version of it for accommodation. You can add. So I was trying to figure out how I can take a picture of that like at home. So you can put like a few of these circles up on the wall or on the whiteboard in the therapy gym. So they have to look up at the board from their deck that's in their hand. And so the card I'm looking at right now has a snowman, a skull, a trouble cloud, and a ladybug, and a tree, and a dolphin on it, and stuff like that. It's using your visual memory, it's getting you to scan the card, you're fixating on one object before you make this kid jump to another object. Might be some pursuits in there as well. And that's all culminating into the higher visual perceptual skills like visual memory and visual discrimination. So let's see here. Is there anything I recognize? Oh, I have a dolphin. Oh, also form constancy. Because not all of the objects are the same size. So I have a dolphin on here. There's a dolphin on here. There's a dolphin on this one as well. And they just point out what they see. You can probably come up with points like between you and the student you're working with. So there's an idea. There was Spotted. So they're looking between the card that they have in their hand, the near vision, and they're comparing it to the boards to the cards that are on the whiteboard or on the wall, to constantly go between near and far accommodation scales, because near and far accommodation can be different, and your eyes have to accommodate every time you go between near and far objects. That's Spotted. I bought one for myself because it looks like a fun game overall. Alright, let's go fishing! It looks different than I remember. I think the only thing that makes it deluxe is that there's 6 rods in the box, not than 4, but let's go fishing game. I don't know if it comes with batteries. Maybe I should include batteries in the toolkit. I don't know. But the let's go fishing game is going to require that visual scanning, maybe pursuits as well. So yeah, pursuits as well. Scanning, try to figure out like what fish you want to go for. Pursuits, you find the fish you want to go for, and you keep your eyes fixated on that object as you track it with your smooth pursuits around the board. Also, dorsal stream. If you're trying to go for a fish that's in the middle, you have this motion that's moving. I think it moves clockwise, if I remember correctly. That's moving in your dorsal stream. So you have that peripheral visual input that's competing with your central vision, where your focus is currently fixating, if that's where you're currently fixating. If you're fixating around the outside, you're more so going to be doing a pursuit. I wanted to go ahead and make another note here when you're documenting pursuit screening. Same thing with cicades. What was I gonna say? Make note of any losses of fixations. That's gonna be more so pursuits. And you can relate that to the age of the child, because the younger the child is, generally the more losses of fixations they're gonna have. So by the age of 7 or 8 or so is when their fixation times are longer, and they're pretty stagnant into adulthood from that point with fixation. So fixation is pretty stagnant around the age of 7 or 8. 7's kind of early, 8 or 9 probably. Accommodation is stagnant by age 13. Yeah. Just trying to make sure I had that in there. Oh, I put some balloons in here as well. Balloon volleyball, I think that's what it's called. Or don't let the balloon hit the floor. Don't let the balloon touch the lava, I guess. I don't know. That's a great game for incorporating visual skills, and you're incorporating the vestibular and proprioceptive systems as well. So there's your balloons. And balloons are fun. We all like balloons. Unless you're my high school French teacher. Anyway, so there's the references. Please refer to this Padlet that I've created either through the and the QR code is locked. But please refer to the QR code to access on the phone, or there is a link here that you can access it on your computer if you so choose to do it that way. I will provide the PowerPoint itself that's outside of the video format to you guys, so you can easily click on this link, because this will be in a video format, as I learned with the presentation I gave last week, and you will easily be able to see the QR code, because I didn't realize my video was going to be covering that. So anyway, thank you for paying attention to this presentation. That's over an hour and a half long, but thank you for paying attention, and I look forward to all of your feedback. There is a feedback form on this presentation that is linked in the Padlet, and I will also get it uploaded to a Google Drive folder for Jessica to get sent to you if that's easier for you guys as well. And please ask any questions, make any comments, or start any points of discussion that you find interesting or necessary to continue this part of my capstone project. Make sure it aids your understanding, and also make sure it ensures my understanding of the whole topic that I've been focusing on this entire semester. But yeah, thank you. I look forward to seeing all your questions and comments and discussion while I'm in Chicago this week at a skating meet. Thank you.